Hey guys, welcome back to my channel. My name is Mandy, and today I'm going to give you guys a life, health, and what's going on with me update. It has been a wild year for me, and not just because it's 2020. So if it's your first time here, welcome. Make sure that you hit the like and the subscribe button, and if you hit that bell, it will also give you a notification every time I upload a new video to the channel. So it's 2020, guys, and things have gone a little crazy. Honestly, and not because of coronavirus and not because of, everything that's going on in the world, but in my life personally, this has been one of the most difficult years that I have had to navigate. I feel like you guys are my friends. I really communicate with a lot of you guys on Instagram, and it didn't feel right not to let you guys know what's actually going on. Just in case you do see a brief period where I do not upload video, because I know that you guys, you guys reach out to me so much, and it's really great. I love having you guys as friends. So I just want to post an update to let you guys know what's going on, and I have quite a bit to update you on. So you guys know that I have been battling chronic illness for several years. Well, it took a different turn. I had surgery in January. I had a hysterectomy. Now, if you guys have kids or husbands around, I would suggest watching this later, just as a little disclaimer, because there are some female things that, you might not want young ones or husbands to hear. But we're not going to be talking about anything crazy, okay? just a disclaimer. So I have a condition, and we know what it's called now, and we know what's happening, and the good news is I am on the path to treatment. The bad news is I'm on the path to treatment, and it's hard. We haven't found exactly what's the right combination of medication for me. One of my YouTube subscribers, and she knows who she is, she emailed me last year, and when I was going through this mystery illness, she sounded the alarm, and she emailed me and said, I think you have this condition, and I really think you need to look into it. She was right. I have something called cyclic vomiting syndrome, and it is exactly what it sounds like. It is cycles where I cannot keep food or water down, and it can be anywhere from a couple hours to 10 or 12 days even. And at that point, you can imagine I end up in a hospital. So this mystery illness usually only coincided with my actual female cycle. And we could pinpoint on a calendar exactly when it was going to happen. And I had a miscarriage in October of 2018, and it was unplanned, and it just happened. I have a history of miscarriages, although I do have 2 children. I do have a history of that, and it happened again in October of 2018, and once things got more normal after the miscarriage, I started experiencing a lot of vomiting and a lot of nausea and things that actually mimicked food poisoning. And I was getting this sharp searing pain right around my belly button. It almost felt like hunger pangs, but extreme hunger pangs, or contractions just in your actual stomach and not lower by your hips. It's like up high, like underneath my rib cage. And it got to the point where my husband was taking me to the emergency room constantly, because I would go through these cycles where I would get so dehydrated, and because I wasn't even keeping water down, I had to go get an IV. It was the only way to actually get fluids in my body so I wouldn't pass out. And I mean, at one point I even hallucinated. I mean, you guys, it got crazy. Well, they decided to give me a hysterectomy this last January. Some of you guys know that, we've talked about that before. The doctors were hopeful that that was going to stop everything because they thought that my cycles were just the catalyst to all of these cycles of CVS. We were hopeful, but it didn't work. Instead, it was kind of like hitting the reset button on CVS, and now it just comes whenever it wants, which is awful. And I can't predict it. I have no idea when to expect it. And I can be fine, like I'm talking to you right now, 1 minute. And then in 10 minutes, I can be in a different state. And that's the really hard part. And it gives me a little bit of anxiety, as you can imagine. I'm always scared, kind of like when you're 9 months pregnant with your first child and you have to go to the grocery store and you're kind of afraid that your water's going to break in the middle of Walmart. It's kind of the same feeling. I kind of feel like I'm so scared that something's going to happen to me. My problem mainly is with driving because the sharp searing pain in my stomach is so severe that if I'm behind the wheel of a car, it can be very dangerous for me and anybody else who's on the road with me, and my children if they're in the car with me. So I haven't driven a car in probably 6 months, which makes me feel very dependent on my husband medically. And I hate that. I really hate that. Well, while we were trying to figure all of this out, my grandmother died in July. And that was when things got really bad because I didn't know it. But stress is a huge trigger of CVS cycles. So I went into a full-blown it was awful. I was sick 4 times during the funeral service. And not only is it super embarrassing, but it's so hard for me to control because of the way that this is. Each CVS patient seems to have different severities and things, and that's mine. Stress apparently causes mine to get out of control. So I went to the GI. The GI did several procedures and tested everything. Like, I had so many biopsies taken and everything came back negative. I was tested for cancers. I was tested for genetic disorders. But the thing is CVS is a genetic disorder that you cannot detect on a test. My GI didn't know anything about cyclic vomiting syndrome, and honestly, most doctors don't. So a couple weeks ago, about 4 weeks ago, I got really sick at the table and vertigo started happening. Vertigo's never happened to me before, ever. That's a brand new thing. But like I said, after surgery happened, and my body is now trying to readjust to everything, it was like somebody hit the reset button on my CVS. So now it acts and behaves differently, and there's also new symptoms coming up. Vertigo was one of them. I've never had vertigo, and it was almost like I got off a ride at the state fair. I'm from Indiana and we do state fairs. And I honestly had that feeling like I was 10 years old again on the Gravitron trying to walk out. And it was awful. And my husband got me into bed and I took a nap after I got sick. I took a nap because it exhausts me. I woke up and I was just angry. I was really angry. I started looking on the internet, and for the first time in 2 years, there were articles about CVS, and it was just like an answered prayer. And not only that, but the stomach pain, which they thought was a separate issue from my CVS, turns out that it is something called abdominal migraines. And CVS is a condition that migraine patients have. So it's all connected. So my chronic condition since I was a child is migraines. I've had them since puberty, honestly. And it turns out that in the brains of some patients, they are either born with or develop CVS. It's more prevalent in children, but sometimes it does what happened to me and it goes dormant for a while and resurfaces. Mine resurfaced 30 years after. And I didn't know it because I was too young to remember, but apparently I had vomiting issues when I was a child. I had the very classic CVS symptoms as a child. And back in the 80s, they didn't know anything about this. So now it all makes sense. And I started reading, and I found a support group. I found a support group on Facebook for CVS patients, and I started reading, and I found out that not only do they have the same pain that I do, but they see a neurologist. And I realized I've been seeing a neurologist for the last 3 years in my town. I go get my preventatives for my migraines. So I picked up the phone immediately and I called the neurologist and got an appointment. And I walked in there and I said, I don't know if you can help me, but I have CVS. I've been diagnosed with CVS for the last year, but the hospital hasn't known how to treat me. Is this something that you know about? Can you help me? And my doctor she knew everything. She knew what CVS was. She knows how to treat it. It's a neurological disorder. So CVS is a genetic disorder I've had since I was a toddler. And for whatever reason, it came back, it resurfaced, and we have been trying to figure out everything ever since. And I have gone through so many testing, things for cancer and celiac disease, and everything's come up negative, everything. But I know what I have now. Thanks to one of my lovely YouTube fans, I know that I have CVS, and she knows who she is, and if she hadn't told me about CVS, I don't know if I would be where I am now on the path to treatment. My neurologist now is prescribing me different medications, and we're trying to find the right combinations of things that work for me. It's not going to be easy, and it's going to be a long road most likely, but we're on the right road. So even if the trip is long, we're going the right direction instead of going around and around in circles because I keep testing negative for everything that all 3 of the other doctors are trying to test me for. I have a neurologist who knows exactly what's going on, and she is working with me. So I'm going back in 3 weeks. I just got my first trial medications. I'm trying to get used to them. It's really hard to get used to some of the drugs that I am on. And when I say drugs, I mean prescription drugs from my doctor. Some of them make me feel kind of trippy. But, you know, I am so happy. I'm so elated. And I'm so grateful to the YouTube friend who told me about CVS, because I don't know if I would be here if not for her. So if she is watching, thank you so very much, because if not for you, I don't know where I would be in treatment. So now I'm on the road to recovery. Now I have to figure out how to adjust. I'm trying to find triggers. I haven't found anything that actually triggers it yet, but I'm trying. I have found the patterns to how this disease works, but I just have not figured out if there's anything that I am doing, and most likely there's not. It's just going to come when it comes, and I can only put out the fires. There is no cure. There's always hope for a cure, but right now there is no cure for this. It's something within the brain of people who have migraines, and typically they come from a long line of people who have also had migraines. It's not just something that women can get, men can get it as well. And it is a rough road because there is no cure. But things are looking up. I'm very prayerful, I'm very hopeful, and I'm gonna beat this. Even if I can't cure myself, I'm going to improve my quality of life. Even if I cannot be the same girl that I was 3 years ago, I can live life to the absolute fullest that I can. And I am happy with that. I am happy that I'm not in the state that I was at this time last year. At this time last year, it was at its height, and I have so many things that I could say about that. But, oh man, that was hard, you guys. I'm not gonna cry on camera, but it was some of the roughest moments of my life. And then when my grandmother died in January, in July, her birthday is in January, it was like I lost a parent. My grandmother was like, she was like a second mom to me. So losing her threw me into a tailspin. And I have been really struggling, really struggling. Sorry guys, I've been really struggling since she passed. But things are looking up, things are looking great, and I am so thankful for all of you. So if you do see me leave and come back, or if you see periods of absence on my Instagram, that's why. It's not because I'm inattentive or I am ignoring you guys' messages or, you know, anything like that. I'm just sick. So please keep me in prayer. Please keep my doctor in prayer, and hope and pray for a cure. But until then, we're going to do good. We're going to do fine. And I am so excited for all the things that are going to be a part of my life again, because I am on the path to treatment. Thank you all for your support and for your well wishes, especially all of the things on Instagram. You guys have seen me go through some of this stuff on Instagram and through my stories and my pictures, and you guys, you keep me going. So thank you. I appreciate each and every one of you. So that's all I have for today's update. I hope you guys have a great rest of your day. Happy homeschooling, and I will see you in the next video. Bye.